The basic glaucoma exam part 2. This is again part of the orientation series. The three basic components of the glaucoma exam, as we saw in the earlier lecture, include measurement of the IOP, or intraocular pressure, optic nerve head assessment, and visual field assessment. This lecture is going to focus on the optic nerve assessment, which can be done clinically as well as with various tools for optic nerve head analysis. Optic nerve head evaluation can be done clinically with a direct ophthalmoscope or via indirect ophthalmoscopy, which is frequently done with either a 78-90 superfield lens or ruby lens. There are various optic nerve head analysis machines on the market. We have the HRT and we have the Cirrus OCT, but there are a number of different permutations of these devices. Indirect ophthalmoscopy is the clinical assessment of the nerve that you all need to master. It's done with either a 78 diopter lens, 90 diopter lens, superfield lens, or ruby lens. I've showed two lenses here on the right side of the slide, and you could see that the difference in diopter lens creates differences in the magnification. And so the actual size of the optic nerve will vary depending on what nerve depending on what lens you look at the nerve with. So for example, if you were to measure the height of the optic nerve using a 78 diopter lens, to figure out the actual height, the true height of the optic nerve, you need to multiply that reticle height times 1.1. With a 90 diopter lens, you need to multiply the reticle height times 1.3. A 60 diopter lens gives no magnification of the nerve, but we don't commonly use that in the clinic. Remember, some clinical tips for performing the slit lamp exam are to keep the lateral canthus of the patient in line with the little black mark that's typically on the side of the slit lamp bar. Use a thin beam of lower light intensity, and you usually want to keep the switch on the slit lamp at the 10% neutral density filter or the heat shield setting to make it a more comfortable exam for the patient. And typically when you look at the optic nerve, you want to start with the viewing arm and the illumination arm in line with each other, similar to the position you'll use when you try to look at something with retroillumination. Here's a little video of what you can start to look for. This was taken through an actual eyepiece using a little portable camera, so the image quality is rather poor, but you see that you get that orange glow. And if you focus within the orange glow, you can oftentimes pick up the blood vessels, which you can then trace back to the optic nerve. When you're actually doing this with your hands, you'll see that you can get much better quality images than shown in this video. But this gives you a decent idea of what to look for when you first start looking at patients' eyes. Again, clinical tips: just line a slit beam up to go through the pupil, and you want to move the slit beam about 6 inches away from the patient. You hold the lens over the eye, and a slight tilting of the lens can actually improve visualization and cut down some of the glare, and that's something that you just have to learn as you do the technique. You look for that reddish-orange rectangle, and then you try to focus on the image in that rectangle, which is usually at first a blood vessel or the edge of the optic nerve. If you have the patient direct their glance towards your right ear, it'll help towards the examiner's right ear, or the person looking at them, their right ear. You'll be able to see the patient's right optic nerve. And similarly, if the patient looks at your left ear, it will help you be able to visualize the left nerve better. The normal appearance of the optic nerve will be shown in the following diagrams, but you'll typically have small symmetric cup-disc ratios that should be less than 0.5. The degree of cupping will vary depending on the lens and method of observation. There should be some salmon-colored rim tissue extending all the way around the optic nerve, and you may in fact see some pulsations of the branch retinal veins as they come off of the central retinal vein. So here we have the normal appearing optic nerve. Now what I've done in these images is there are two images side by side. And if you fuse the images, if you let your eyes relax and you look at the image in the center, it will appear in 3D, similar to the view that you'll get when you look at the nerve through the slit lamp using one of these lenses. And again, it might be worthwhile for you to just stop and take some time to try to master this or learn this, and it will make the rest of the lecture kind of fun. And also, this is typically the way that optic nerves can be presented during lectures, and it's a skill that you can use then as well. Okay, the blue line that I've drawn around the nerve in this case gives us the approximate clinical edge of the disc margin. It's not exact because of the way it was drawn using PowerPoint, but for the purposes of this lecture, it's fine. There will be a